Good evening, everyone. Dr. Tini Tankachin, on behalf of Gleneagles Hospital, Mumbai, welcome you all again for our today's session on acidity. It is my pleasure to introduce Dr. Vikas Pandey, who is a senior consultant in the Department of Gastroenterology at Gleneagles Hospital, Mumbai. He is MBBS, MD, DM Gastroenterology. He has more than 20,000 endoscopy procedures to his name. His expertise is in managing all types of GI disorders and performing all types of diagnostic and therapeutic GI endoscopies, including ERCP, EUS, EMR, pancreaticobiliary endotherapy, diagnostic and therapeutic endosonology. We welcome you, sir.
Thank you, Dr. Tiny, for the kind introduction.
As I've mentioned about our session today, acidity. We would like to start with a question: what is acidity?
See, acidity means actually different things to different people, but as clinicians, if any patient who comes to us complaining of more of heartburn, symptoms like heartburn, bloating, fullness, tightness, heaviness in the upper abdomen predominantly or the epigastric area, we relate that to acidity. It can also have other symptoms like sometimes difficulty in swallowing, which could be a spectrum in condition like GERD, gastroesophageal reflux disease, but sometimes difficulty in swallowing, having some sour taste in his mouth called water brash, or sometimes certain foreign body sensations, choking sensations. So various symptoms can be related to the broad term of acidity, but yeah, in general, any for a common man, any burning sensation in the abdomen or in the chest region, they consider that as acidity.
And what are the causes of acidity?
See, causes of acidity are many. To start with, just could be your food pattern. If the food pattern is not good, or rather than good is discipline, there's no particular time where you are consuming food, the habits are erratic. People do relate spicy, oily food with acidity, because these food have a lot of delayed gastric emptying time. That means it takes a lot of time for the food to get cleared from the stomach. So oily and spicy food tends to cause a lot of acidity. There are certain medicines commonly used, certain antibiotics, certain medicines, painkillers, medicines used to control asthma, and then uh, even multivitamins and calcium tablets, if not prescribed by the correct person and taken in wrong doses, can lead to acidity. H. pylori infection, nowadays people are becoming aware of that, is a common infection. It's a common bacteria which is found in our stomach. It is always there, but in certain patients, it tends to produce inflammation, and because of that, patients develop symptoms of acidity. So, H. pylori bacteria is one of the reason for people having acidity, and then of course you have to rule out other conditions like ulcer disorders, and even it could be an early symptom of malignancy, GI related malignancy. Certain behavioral problems can also cause it, like stress, anxiety, and depression, where the brain gut axis gets affected a lot. And then there are negative hormones which are secreted in the body, and because of all these things, patients have a disturbed stomach, or commonly known as stomach upset. So they tend to experience a lot of acidity issues because of all these things.
And what are the symptoms of acidity?
As I said, acidity predominantly people feel is burning sensation in the stomach, but mostly in the upper abdomen. Apart from that, people can have bloating, tightness, heaviness, fullness in the abdomen, always trying to eat and always having their tummy full. They're not able to eat much or up to their satisfaction. They These symptoms could be related to acidity. Apart from that, certain atypical symptoms like difficulty in swallowing, predominantly if it is a gastroesophageal reflux disease where you complain more of heartburn, and years of heartburn later on, patients start difficulty in swallowing because of strictures developing. The esophagus gets narrowed, and then they develop difficulty in swallowing. Then belching, also a lot of gas release from your mouth is another symptom of acidity because of too much of gas production. And then water brash, where a sour taste comes in the mouth. And then uncontrolled cough. These are atypical symptoms, but yes, uncontrolled cough. Sometimes patients get treated for asthma and from the chest physicians, but since it is not under control, they are asked to meet gastroenterologists, because these symptoms can be a symptom of acidity, where you have to control the acid production inside the stomach. And then laryngitis, hoarseness of voice, recurrent dental caries, and ear pain. All these symptoms are particularly, they come under the spectrum of gastroesophageal reflux disease. But yes, acidity can cause all this, uh, up to the extent that people stop eating, they decrease their food, and the appetite goes down, and then there is weight loss. And then entire day people are probably bothered about their stomach, tummy. They keep on thinking that something is wrong with them, and this is a vicious cycle. Then it gets into their head that something is wrong with me, their functioning gets affected, and it's a cause of a psychosomatic depression, where patients are mentally, they become upset and they find difficulty concentrating anywhere. So from a small symptom to from heartburn to an extreme symptom where difficulty in adjusting to their work can be a symptom of acidity. Yes.
So, are the symptoms of gastritis and acidity similar? If yes, how can one understand or differentiate the difference between gastritis and acidity?
See, gastritis is basically a pathological diagnosis. That means a patient you comes to you with acidity, you do certain test, a test like an endoscopy where you put in a camera and try to visualize the stomach mucosa how it is, and you find there is redness, there are erosions, there are ulcers, and kind of some pathognomic findings which you have found. Or certain times we take biopsies if we find some severe inflammation. That biopsy will tell us that mucosa has been infiltrated by neutrophils and lymphocytes, and that is called inflammation. So gastritis is a probably a more medical term as compared to acidity. Acidity is a common man's term. So yes, acidity is a symptom. The pathology could be gastritis. So gastritis is a pathological diagnosis. Otherwise, symptoms wise, they both are actually same.
Okay. So, as we have rightly mentioned before, food timing also impacts acidity. So nowadays, as all are working, many a times people skip their food, skip their meals, or they don't have timely. If at least their lunch or their dinner, they skip it. So even if it doesn't affect them at present, can that affect or create any ulcers or acidity after a few years or months?
See, the discipline, any form of life is always required, be it work, be it food habits, be it exercise, be it everything, right? So problem is, if daily your schedule gets changed because of your timings, there's always something called, if I try to explain medically, there's always called a cephalic phase before the gastric phase. That means whenever you have to eat, your lunch time is probably 1:30 most of the days. So by 1 o'clock, your brain starts getting activated. So now you are going to have food. So there's a cephalic phase where the brain starts secreting certain neuromodulatory hormones, where uh, chemicals are secreted. They signal the stomach that they have to release certain chemicals, so that the sensation of being hungry is assimilated by that body. Okay, now I'm getting hungry, and now I have to eat. So that cycle gets disrupted if every day it is changing. Your brain doesn't know when it has to start and when it is not to start. So you're confusing your own self. If there is a daily pattern, then daily you have, if your body functioning is normal, you will have a sensation of being hungry, and then you will have your food, and the digestion will occur, and everything will fall into place. But every day if it is changing, so that means the brain does not get that daily exercise. It does not know when to start producing the hormones, neuromodulatory hormones, and then the cycle gets disrupted. So once it gets disrupted, slowly and steadily the appetite goes down, and then there is a, if suppose you're supposed to eat at 1 o'clock and then you skip your meal and you had something in a hurry at 4:30, 5 o'clock, and then suddenly you have to take an early dinner. So all the cycles gets disrupted. Once the food goes inside the stomach, it requires ample time to be get empty from the stomach. That is what is called as gastric emptying time. It requires for solid food, it requires at least 4 to 6 hours for the food to get emptied from the stomach. So that cycle again gets disrupted. Once this gets disrupted, the entire gastric secretion gets disrupted. So cephalic phase, gastric phase, then a clearing phase, everything gets disrupted. So and in between, if you keep on eating without any schedule, the gastric juices get secreted. So sometimes they will affect your stomach lining, the mucosal lining, and if they are constantly stimulated to produce the gastric juice, somewhere down the line it might affect your stomach, can lead to erosions and ultimately can lead to ulcer formations.
Okay. So we have seen people saying we don't understand the difference between acidity and if something is related to heart, chest, heartburn, or anything, a mild attack. So how can one understand the difference?
That's a very good question. But yes, in practice also sometimes patient comes to us, doctor, I'm having a pain here and I'm having a discomfort here. So you have to see. I mean, first is always the heart takes a priority. If the patient is coming to you for the first time and middle-aged man, certain risk factors are there: smoker, alcohol consumption, on obese, cholesterol disorder, and it directly comes and complains to you, since last 4 hours I'm having discomfort and having some heaviness and I'm having some bloating sensation and I'm really not feeling good. First priority is always the heart, because acidity can always be treated. It is never so serious that it could be life threatening, but heart will not give you a second chance, or it always takes the priority. So whenever in doubt, this profile of patients who's come to you, you seeing for the first time, you're not very sure, always get an ECG done. Always get an ECG done. And I had lost my neighbor similar way. At night they had called me and I told them, "Hey, get an ECG done. Doesn't look good." No, no, this is acidity only. He always had a blah, but he doesn't look good to me. Get it done. They waited till morning, and morning that was not supposed to happen, but yes, he passed away the next morning. He developed severe pain at 5 o'clock in the morning and he collapsed. So this is a very common situation. So a profile which is fitting into this, you should always take care that your first priority should always be the heart. Second thing is, again, the second scenario is a young boy who's coming to you with, it doesn't mean that young people don't have heart attacks, but he's come to you and he's been having these symptoms for many days now. Last 4 5 days, say he's having no heart attack, goes on for 4 5 days, right? So he's having for last few days or probably a 1 or 2 week, then you are fairly sure that this could not be cardiac. You need to rule out, but then that is not the priority, right? So that situation you can still label it. It is very difficult to absolutely clear both of them. Yes, a patient comes with a severe pain, probably heaviness in the chest, excruciating pain, probably radiating to the arm, classical symptoms, sweating profusely, BP going up, heart rate is fast, difficulty in breathing. Yes, you always know, okay, this is cardiac, and you have to send the cardiac markers and do ECG and everything. But subtle symptoms, it is difficult to differentiate. You need to be really suspicious of what exactly the patient is complaining. Always err on the more serious side, where heart takes the priority, and you investigate for that. Later on, yes, if it comes negative, it could always be said that acidity is the cause and you could easily treat it. Vice versa, if you treat it as acidity and it turns it to be a cardiac cause, I mean, it's difficult to answer later on. So it's better to err on the more serious side.
And it is a wise decision to consult a doctor
Yeah,
timely
surely.
rather
Yes,
than
surely,
keeping
surely.
it
I
on.
mean, an expert needs to be always consulted. Yes, late night we do understand that for every time it's not a possibility, but any symptom lasting for 3 to 4 hours and you're not getting relief, always consult a doctor or hospital where basic investigations can always be done.
Okay.
Yeah.
So going ahead, what are the complications that can happen due to acidity?
Untreated acidity, if it is going on for a long time, patient to start with is from the esophagus. If you see, uh, it is esophagitis. That means inflammation of the esophageal mucosa. Patient develop a lot of heartburn. Sometimes they present to us with bleeding as well. They vomit out blood because of that. Then there is something called as a Barrett's esophagus, where long time acid exposure changes the mucosa or the epithelium of the esophagus, and it converts into the gastric mucosa, and then it's a pre-malignant condition. Long-term acidity or gastroesophageal reflux can lead to something called Barrett's esophagus, and that's a pre-malignant condition. Inside the stomach, you can have many things like from a small thing like an erosion to a big thing like an ulcer. An ulcer can be both benign or a malignant. So benign ulcer also tends to cause complications such as bleeding, perforation, severe pain, and these complications are known. And rarely peptic strictures can form in the esophagus as well as in the stomach area where it is difficult for the food to pass. So if it happens in the esophagus, you might have dysphagia, that is difficulty in swallowing food. If you have inside the stomach, it can block the stomach opening, and then they have gastric outlet obstruction. They whatever they eat, they vomit out in 3 4 hours. So these complications are known. And lastly, H. pylori untreated for years can be a precursor for a stomach cancer. So these complications are known. Even atypical complications like laryngitis, recurrent aspirations, cough leading to aspiration pneumonia, all these things can be uh, considered as a complication, long-standing complication of acidity.
And how is it diagnosed?
See, diagnosis is first obviously clinical judgment. From the history of the patient, you tend to know what he or she is trying to tell you. Symptoms are will guide you towards the diagnosis. And then there are certain investigations. The commonest, most widely, most easily available is an endoscopy, where it doesn't mean that every single patient who comes to you with acidity has to undergo an endoscopy. It means that if you have aptly treated a patient of acidity for at least 2 to 4 weeks with good doses and good drugs, and after that also you don't find it to be beneficial, then you have to consider that for your diagnosis you need to have certain evidence, and then you do an endoscopy. On endoscopy you try to see, as I said, could patient be having gas esophagitis, could be having Barrett's, could be having gastritis, could be having erosion, ulcers. We take samples for H. pylori infection to determine the cause of this acidity. So, endoscopy is the primary mode of diagnosis in cases of acidity. Beyond that, there are certain other advanced investigations like 24-hour pH metry, esophageal manometry, but all these things come into consideration once the patient is planned for a certain therapy, like surgical consideration is being considered. Then only these advanced investigation come into picture. But per se, clinical history, judgment, uh, in fact, a response to PPI of a patient, that is proton pump inhibitors. Patient is come to you with symptoms, you've treated him with those medicine, and patient is doing well. That itself suggests to you that the patient is suffering from acidity. So history, response to treatment, and diagnosis with the help of endoscopy can help you know the condition. Yeah.
Okay. So we have seen patients who are under certain treatments. They are prescribed pan to have before the food or something. So many patients or many people, you say, they miss having pan or any other antacid, any medicines. So does that cause any acidity further on during their treatment?
See, the all kinds of molecules available in the market, except one which has been recently launched. All molecules have to be taken 20 to 30 minutes before your food, because that way they have been designed. As I told you that half an hour, 45 minutes, your brain starts working, it sends signals to the stomach, then the proton pumps get activated, they start secreting acid, and then that is how you get hungry. But if they are going disproportionate, then you have to suppress them. So there are certain medicines which has to be given 30 minutes before your food intake, if and then only they will suppress, because that is the time the proton pumps are active maximally. Once you have your food, they all get used up, and then there is nothing to present there to be suppressed. So if you take your medicines which are supposed to be taken before food, you take it after food, does not have much effect. The potency is lost. Now, and recently, a new molecule has been launched in the market which can work irrespective of the time it is taken. So it can be taken before food, it can be taken after food. It doesn't make much difference. So that per se will not actually increase the acidity if you take the medicine, but the benefit is lost. The point of giving that medicine is lost. So it doesn't work if you give. So it has to be taken as prescribed by the doctor.
Even if they miss it.
Then probably it will not act. For your self satisfaction you might take it. So there are certain other kind of medications. Generally a single tablet is not given. Yes, we might give if the symptoms are very mild, but then there are certain different types of antacid available in the market which are taken, which has to be taken post meal only. So that can be taken. And the same drug which was supposed to be given before food, if it is taken after, does not have much benefit. So there are other medicines which can be taken after food and they will work well. That's it.
So what? How is the treatment planned for acidity?
Again, the symptoms tell you how good or bad the symptom is, how long the duration is. Generally, a single dose medicine before food, half an hour food, many molecules are available, different families of molecules are available, is given to the patient. If he or she is not responding, you make it double. Before that, you prescribe, you advise the patient, you try to find out the cause. If it is the food which is troubling the patient, if it is habits like smoking, alcohol, too much of variations in the timing, too much of stress, too much of anxiety, are there any medicines, painkillers which the patient is continuously having, certain antihypertensives do cause a lot of acidity. So all these history need to be taken before planning the treatment. Is there an obvious reason for the patient to have acidity? I mean, patient is having arthritis, is taking painkillers every day, is bound to have acidity. If the patient is put on steroids, high doses, he might have acidity. So certain medicines are known to cause it. Underlying medical conditions like diabetes, thyroid, all these conditions tend to cause a lot of gastroparesis. That means delayed gastric emptying. So these patients will have acidity if they are not well controlled. If you're not taking your sugar tablets and you expect that acidity will be always controlled, that's not happening. So history, then medicines, then underlying medical condition all need to be taken into account. And then after that these medicines comes, where there are certain medicines which you give before food, there are certain medicines which you give after food, and these are antacid. Then there are certain prokinetic agents which tend to increase the activity of the stomach. That means a patient who has a lot of bloating will have certain different medications in their prescription as compared to another patient who has just heartburn in their symptom, right? So those two symptoms are different, so you need to treat them differently. And then certain times you need to diagnose by doing an H. pylori testing, because whatever you might give to these patients, they might not respond, and then you might have to treat them with certain antibiotics to kill the H. pylori infection. And these ways, the treatment is planned for all patients.
As prevention is always better than cure, we would
Yeah,
like to
definitely,
know.
especially in acidity, definitely.
Yeah, so we would like to know what are the preventive measures one can take.
See, as we discussed, discipline is very important. To have your food on time, the type of food is important.
Spice, avoiding spice.
Every day if you having outside food, in because of the offices nowadays, corporate culture is very strong, and people skip their lunch, or don't get time to have the meals being prepared or sent from home, so they try to have their food in the canteen. So the type of food being prepared, especially the oily, spicy, lot of mayonnaise, lot of butter, and all those things, they tend to be hard on the stomach, tends to cause bloating, fullness, tightness, heaviness, and acidity will be an issue. People have the habit of having soft drinks with food a lot nowadays. You know, any form is definitely will cause an increase in the acidity. So type of food has to be definitely looked into. Beyond that, habits like smoking, alcohol consumption, nicotine in any form can definitely cause. Nowadays, vaping and so many other things have come up, which definitely has certain chemicals which can increase your acidity. And then, apart from that, everybody's life nowadays has started becoming stressful, right? From running to the office, getting on time, traveling, work pressure, targets, everything. So everyone is under a lot of pressure. So stress and anxiety, mm, has to be dealt with. Even children are now facing with these issues because of too much of pressures from parents, families, and everywhere. So stress, anxiety, depression has to be managed, and then obviously the medicines, over-the-counter medicines for small things like a small symptom like an headache, and you keep on having medicines, don't get treated. You might be having migraine, and you keep on popping painkillers, which will not going to solve your issues. Dental caries, you just keep on having medicines. Back pain, you don't get it evaluated, and you just keep on having painkillers because you probably don't have time or whatever it is. Cervical pain is a very common cause nowadays, especially with young people having laptops and everything. Analgesic, painkillers. So all these things have to be looked into. It has to be checked. The diagnosis has to be reached, and unmonitored medicines has to be avoided. It has to be taken care of. And if you follow certain things, so definitely discipline in life, having food properly, and avoiding unwanted medications would definitely decrease the amount of acidity you'll be having, for sure.
If you could suggest some home remedies for our viewers.
See, actually, people do try it. It has not been proven medically, but certain things people try. Cold milk, whether it is scientifically proven, it's difficult to say that, but logically, it could help because it has calcium, which tends to make the pH of the stomach slightly more alkaline. Even buttermilk has little bit calcium, and calcium tends to make the pH from acidic to alkaline. So, the theoretically, it can decrease acidity. Apart from that, after food, people use fennel seeds or soft, whatever they call, and according to Ayurveda, they say that helps in the healing of the mucosal lining of the stomach. It tends to keep your stomach cool, and then that is the reason it has been always used that way. So it tends and it has been used in medicines for the children as well because it tends to decrease the flatulence, the amount of gas production. So people have used that also. There's no harm in trying that. And jaggery people consider decreasing acidity. So after food, if you have a sweet tooth, then you always want to have something sweet upper. So rather than having certain creamy stuff or certain things which contains a lot of lactose, which can again cause intolerance and acidity, you might try that. Um, these things have been proven. Apart from that, drinking enough water, prevention of dehydration, avoiding certain things is always considered. But yes, certain basic things can be definitely tried. And people have also tried in fruits like banana because it contains a lot of fiber, because of the fiber, and it contains something called pectin. Pectin is a protein which tends to uh, uh, improve the healing of the stomach mucosa. It has been proposed that way. Again, it has not been proven, but any fiber containing food is always good for the stomach. So these things have been definitely tried to reduce acidity. But if it is frequent, if it is uncontrolled, then it is better to always consult an expert for it because they are always available to help you out here.
Yeah. Thank you so much, sir. It was a very informative session. A basic
Thank,
topic, a general topic, which I think everyone would have gone through in their life. Thank you for your valuable information. I
thank
thank
you,
all my
Anjali.
viewers for spending time with us. Stay tuned until our next session. Thank you.
Thank you very much. Yeah. कितना टाइम